a lot of people come in who need bone grafts, and they'll ask what type of bone grafts are there. And one of the best grafts is one we can simply buy off the shelf. There's hundreds of types of bone grafts, of techniques that are performed in the dental implant arena. And like I mentioned before in another video, one of the most common is a sinus graft. And so the type of bone graft that works really well for that is an allograft. What's an allograft? Well, we have basically 4 different types of grafts that we can choose from, and some people come in with an idea of what they want. But an allograft is Latin for allo means other. And what that means in Latin, and what that means is it's another person's bone that is used. So we use cadaver bone for this graft primarily, and it works great. Other types of bone that are great to use, although we don't use them here, but for, it isn't any reason not to use it, but other types of bone that can be used, a second type of bone is called a xenograft. And that means another species, not in the people realm, but another species like cow or horse or pig. And so that is a xenograft, and those xenografts are commonly used in those different sorts of species. Then there are autogenous grafts. And so for people who don't want anything to do with allografts or anything to do with xenografts, we can use an autogenous graft, their own bone, and borrow some bone from someplace else. A very common area for that is the lower chin area, or the ramus, the ascending ramus. Very abundant in bone. Sometimes there's lingual tori, and it helps in the periodontal pathogens on teeth. So a lot of times when we see a lingual tori, that's perfect autogenous bone graft. It's really probably almost becomes the primary indicator for bone, because not only are we using your very own bone, which is the gold standard, we're also treating another site in the mouth and making it healthier. So I think that's a great type of bone to use. And for people who say, oh, I don't want to use my own bone, I don't want a second surgery site, I don't want to use somebody else's bone, an allograft, and I don't want to use an animal's bone like a pig or a horse or a cow, then there's bone that we can simply buy from a lab, and the lab makes the bone. They use calcium, phosphorus, magnesium, use a matrix, make it look like bone. A common matrix that's used is the coralline crystal structure, because it has no blind endings. So in theory, the blood cells can go through the coralline crystal matrix type of structure of bone, and a little blood vessel can grow in and out the other side. And so that's commonly thought, although that the probability of that actually happening has formerly been low. They're working on it, and I think it's improving, but the blood cells don't really form vessels through the tiny openings. But what's really cool is your own bone cells break down that structure and use it as a matrix to form your own brand new bone, which is actually you and your own bone. So those are the 4 different types of bone grafts: the allograft, the xenograft, the autogenous graft, and then lab bone. Then after we choose the bone graft material that we're going to use for a particular type of situation, then we want to pick the particle size. And sometimes we want a big robust particle size that doesn't turn over that readily, and sometimes we want a little bit smaller particle size where your bone cells will turn it over and it becomes ready for an implant a little bit quicker, which is, most people want to kind of get their implants done in a day. So we're working towards a bone that is strong enough to hold an implant as soon as possible. So one of the most popular sizes of bone graft material that we can buy in a jar is a particle size of about 500 to 1,000 microns, and that's probably my favorite, my number one that I use. And it's looks kind of like a sand that you find at the beach, maybe a little bit yellower, and you add a fluid to it, and it makes it like a little sandcastle. You can just build like a little sandcastle out of it, and then put it in the area that you need bone, and it eventually grows over and turns into real bone. Another particle size that we use very commonly is one for a cortical bone graft, and that's one that we're trying to build the outside of the bone. And with that, we need a particle size that's a little bit more robust. It's probably about 1 millimeter to 2 millimeters in size. And when we get that in there, then the epithelium, the skin doesn't press on it and kind of dissolve it away. And we have to use little tenting screws. And so over time, as it turns into real bone, it's the tissue and the gum tissue is not able to press down on it and cause it to just dissolve away and resorb really quickly. So that's a very great size to use for cortical grafts. Another size that we use is more of like a little powder, which is fabulous to use for extraction sites. And so for an extraction site, we can try and preserve the ridge as much as possible, because the number one resorption happens when the tooth is extracted. In fact, I did a publication back in my residency with Dr. Wolfel, which was outlining how bone loss occurs and how rapid it is. And the results of that study of a 10-year panoramic radiographic study showed that the most dramatic bone loss occurs in people without teeth, edentulous patients, in the first 5 years of their teeth being removed. And we know now, there's been further studies that show that the minute a tooth is removed, the most dramatic bone loss is at that time. So we do everything we can to keep that from happening when the tooth is removed. Instantly, if you don't put a bone graft there, the tissues collapse in, the epithelium wants to just go into that hole, and so if it does, then the bone just takes on a much thinner and smaller shape and lower down, or higher if you're talking about a top tooth. So we try and get the bone in there to make sure there's an abundant amount of width and height to hold a very long, strong implant. So that was going over the different types of bone choices and the different most commonly used sizes of bone.